Bettina, thank you so much for joining us at the World Health Summit this year.
Pleasure, Jay.
Thrilled to have you. But tell us a little bit about what you built at HealthDirect Australia.
HealthDirect Australia runs a national triage health information and advice service for Australians. We're there for when consumers don't know where to go, what to do, or how to manage their symptoms. So we provide information to consumers about their symptoms, what services they need, and how to connect with care. Last financial year, we had 85 million people contact us, mostly digital and about 5 million over the phone.
That's terrific. Well, tell us a little bit about the impact the platforms had on the lives of Australian citizens.
So of the consumers who contacted us last year, for those we triaged, we were able to connect 350,000 with information on how to safely care for their symptoms at home. So this was for low acuity things such as children with gastro, such as infections that people were able to manage with contact with pharmacy, and how to safely manage at home with paracetamol, etc. So keeping people at home safely was a really big outcome for us. At the higher acuity end, of all the consumers who told us they intended to attend an emergency department, we were able to connect 51% of those with lower acuity care in the community, such as general practice, telehealth appointments, or virtual EDs.
You can have a great impact if you have a trusted digital channel to engage citizens. Great story. Well, tell us a little bit about your vision for the future.
So in Australia, about 4 out of 10 Australians have a language other than English spoken at home. And often these are the people with the highest healthcare needs and the worst healthcare outcomes. So we provide at the moment our most popular content in 16 languages, but we manually translate that. We also have a translation service on the phone line, but that involves a person translating from one language into English and back again. So our vision for the future is to have AI help us to translate our digital content in real time into many different languages at a level that is clinically safe and of clinical quality rather than consumer grade. On the phone line, we want to have real-time translation for the audio so that the consumer can speak their language of choice, have the nurse see that in English and then be able to respond back in language. And we think that will improve our access into some of these most vulnerable communities and to improve the health outcomes for these groups.
That's great, a lot of promise there. But speak to us a little bit about the underlying technology for what you've built so far, as well as what your vision is for the future.
So our platform is fully cloud-based. It has been for about 5 years. And what the cloud gives us, rather than on-prem infrastructure, is the ability to scale. So in our line of work, we are really subject to huge surges in demand, whether that be through the winter flu period, when we get a lot of consumers contacting us, over weekends, or over the Christmas period, which is our summer break, where a lot of community health services close for a week or two. So we get a doubling in the demand at some of those periods. So it's quite important for us to be able to scale up to meet that surge, and then to scale back down and to release that capacity so that we're not paying for it when we don't need it. So cloud works really well for that feature. And the other thing we think about more and more is our carbon impact and how much energy we're consuming to provide our services. And by having a serverless infrastructure architecture in the cloud, it means that we only spin up a session as we use it. And so we're only consuming the energy to provide the actual service we need, rather than having latent capacity sitting there drawing down energy when it's not being used. And so that for us is the most efficient way to provide our service.
Thank you so much once again for being here with us at the World Health Summit. We really appreciate working with you, the opportunity to partner with you and make an impact on the lives of Australian citizens.
My pleasure. Thanks, Jay.